So when the Surgeon General of the United States steps up to a podium, especially during a national health crisis, the very first thing you notice is the uniform.
Oh, absolutely. You really can't miss it.
Right. I mean, it commands your attention before they even say a single word. You've got the dark navy suit, the gleaming gold braid wrapping around the sleeves.
Yeah, and the heavy epaulets resting on the shoulders.
Exactly. It just projects this absolute, undeniable authority. You look at that person, and they're framed by the official government seal, and the visual language is basically screaming at you, here is the commander of our health defenses.
Like they're a literal general.
Yes. You assume, okay, here's the nation's chief doctor, and they're ready to deploy resources, dispatch these medical battalions, and just issue sweeping mandates to protect the public.
Well, the visual language is incredibly persuasive, but the crazy thing is it's entirely misleading.
Wait, misleading how?
Because the incredible truth at the center of this whole deep dive today is that the uniform and the gold braid are, honestly, they're essentially the vestiges of a phantom army.
A phantom army. That's a strong phrase.
But it's true. I mean, the Office of the Surgeon General, as it exists right now today, possesses almost zero institutional power.
Zero.
Pretty much zero. Behind that podium, there is no sprawling agency just waiting for orders. There's no massive discretionary budget to go out and fund new national health initiatives.
So it's basically just a suit.
Structurally speaking, yes.
Yeah.
That commanding presence is an illusion. The office runs almost entirely on optics, public perception, and honestly, the sheer audacity of whoever happens to be wearing the uniform at the time.
Wow. Okay, so we are pulling from a massive historical dossier today to examine this exact paradox. We've got all these primary government records, like the original landmark Surgeon General's reports on smoking and AIDS.
Which are fascinating to read in their original context, by the way.
Oh, totally. And we're also drawing heavily on Michael Staub's dissertation on the bully pulpit of the Public Health Service. Plus, we have all this contemporary reporting from the Washington Post, NPR, and Time magazine to see how the public was actually reacting to these figures in real time.
Right, because the real-time reaction is key.
Definitely. So our mission today is to really trace this profound evolution. We're going to map out how this office went from operating as a true chief executive of American public health to becoming, well, essentially a glorified spokesperson.
A spokesperson with a very fancy title.
Exactly. We're going to examine this quiet, bureaucratic government reorganization that happened in 1968, which deliberately stripped the office of its authority.
That 1968 shift is just crucial to understand.
It really is. And then we're going to look at three defining figures. So we've got Luther Terry, C. Everett Koop, and Joycelyn Elders. We want to understand what actually happens when a leader's only remaining weapon is just a microphone.
Okay, let's unpack this, because understanding the machinery behind that microphone is so important for you listening today.
Because we're constantly bombarded with health news, right?
Exactly. In an era where you are just subjected to a constant barrage of conflicting health information, knowing who actually holds the bureaucratic power to shape policy versus who is merely allowed to talk about it, well, it changes how you interpret every major health announcement.
So it's about media literacy, in a way.
Yeah, structural literacy. If you don't grasp the structural weakness of the Surgeon General, you can't understand why certain vital health warnings totally reshape society while others just, vanish into the bureaucratic ether.
Right, they just disappear.
So to understand this void of power today, we really have to look at the machinery they use to actually control.
Okay, so we have to go back to what the dossier calls the golden age of command.
Right, before the evisceration.
Yeah, so from roughly 1871 all the way up to 1968, the Surgeon General wasn't just showing up for press conferences. They held what is known in government and military structures as line authority.
Line authority. That is the magic word in government.
Right, and for anyone who has worked in a large bureaucracy, line authority is basically the holy grail. It means you aren't just an advisor making polite suggestions to a cabinet secretary. You are firmly in the direct chain of command.
You give an order, and things happen.
Exactly. You issue a directive, and the divisions below you are legally and structurally obligated to execute it. No questions asked.
And the origins of this power stretch all the way back to 1798.
Wait, 1798, like John Adams?
Literally signed by John Adams. It was the Act for the Relief of Sick and Disabled Seamen. You see, the early American economy relied entirely on the merchant marine.
Right, all of the trade was by ship.
Exactly. But these sailors were constantly arriving in ports carrying horrible infectious diseases. We're talking yellow fever, cholera, things that could wipe out a city.
Oh, wow.
So the government established the Marine Hospital Service to treat these sailors and protect the port cities. And by 1871, this whole network of hospitals was centralized under a single supervising surgeon.
And that position eventually became the Surgeon General.
You got it. And then in 1889, Congress established the Commissioned Corps to staff this expanding service.
Now, the Commissioned Corps is one of those incredibly fascinating American institutions that, honestly, I feel like most people don't even know exists.
It's totally under the radar for most folks.
It is. It's one of the nation's 8 uniformed services. So it operates right alongside the Army, the Navy, the Air Force, the Marines, but it is entirely unarmed.
Right. It's a mobile medical militia.
A medical militia. I love that phrasing. In the late 19th and early 20th centuries, when a massive yellow fever epidemic would hit a southern city, like New Orleans, for example, the Surgeon General could actually physically deploy the Commissioned Corps.
They would send in the troops, essentially.
Yeah, they could dispatch hundreds of uniformed doctors, nurses, and engineers to go quarantine a city or set up a containment zone.
And it wasn't just emergencies. They managed a vast, sprawling network of hospitals across the entire country.
They had real brick-and-mortar infrastructure.
Exactly. They oversaw major research laboratories that eventually birthed modern biomedical science. They directed these massive, on-the-ground public health programs like eradicating malaria in the South.
Which was a huge undertaking.
Massive. And most importantly, they controlled an enormous budget. They signed the checks and they hired the staff.
So if I'm trying to visualize this, it's kind of like a municipal fire chief. The modern Surgeon General is like a fire chief who is only allowed to stand in the town square and shout that a building is burning.
Right, just yelling at people to watch out.
Yeah, but the pre-1968 Surgeon General was a fire chief who actually owned the trucks, hired the firefighters, controlled the water supply, and could personally drive the engines to the blaze.
That's a perfect analogy. They had the tangible operational tools to execute a vision.
So they were doing real boots-on-the-ground work.
Yes. And if we connect this to the bigger picture, this historical reality, this entire century of genuine executive command, that is precisely why the public still expects the Surgeon General to act like a general.
Because it's baked into our cultural memory.
Exactly. The cultural memory of the American public is essentially frozen in 1967. We see the uniform, and our implicit assumption is that the person wearing it can deploy the modern equivalent of those medical battalions.
We just assume they can build clinics, mandate vaccine policies, and reroute federal funding during a pandemic.
Right. The public expectation is completely misaligned with the current bureaucratic reality. And that creates this massive systemic friction whenever a modern health crisis hits.
People are looking for action, and all they get is advice.
Precisely.
So the great mystery here is how an office with that much institutional muscle, a century of entrenched power, just loses it.
It didn't happen by accident, I'll tell you that.
Right. Which brings us to 1968 and the bureaucratic evisceration of the nation's doctor. During the administration of Lyndon B. Johnson, there was this major reorganization of the Department of Health, Education, and Welfare.
Which we now know as Health and Human Services, or HHS.
Exactly. And buried within this incredibly dense reshuffling of organizational charts was just a devastating blow. The office of the Surgeon General was abolished as a commanding executive entity.
Just wiped off the map as a power center.
All of that line authority, the budget control, the command of the Commissioned Corps and the hospitals, it was entirely transferred away.
But the power didn't just vanish.
Right.
It migrated.
So where did it go?
The line authority was handed to a newly elevated position called the Assistant Secretary for Health.
Okay, the Assistant Secretary for Health.
Yes, and this is a critical distinction because the Assistant Secretary for Health is a political appointee.
Ah, okay.
So the Surgeon General was instantly rendered structurally subordinate to a politician. The nation's doctor was officially reduced to basically 2 main functions.
Which were?
Acting as a medical advisor to the secretary and serving as a public educator.
Wow. So wait, was this a deliberate assassination of the office or just bureaucracy doing its thing? Because the narrative surrounding this reorganization usually falls into 2 distinct historical camps in our sources.
Yeah, you have the defenders and the critics.
Right. So the defenders of the move, they argue that the Department of Health, Education, and Welfare was just becoming completely unwieldy. The public health apparatus had grown so large that having a semi-independent Surgeon General operating their own massive fiefdom was, well, It was administratively inefficient.
Right, they claim it was simply sensible, modern managerial consolidation. Just cleaning up a messy org chart to create a streamlined chain of command that flowed directly up to the president.
Make it more corporate, essentially.
Exactly. But then you have the critics.
And what do they say?
The critics viewed the 1968 reorganization much more sharply. They characterize it as a deliberate neutering, fueled by political impatience.
Impatience with what?
Well, the context of the 1960s is vital here. This is the era of Johnson's Great Society. Specifically, the monumental, unprecedented rollout of Medicare in 1965.
Oh, right. Medicare was a huge shift.
Implementing Title 18 of the Social Security Act was an absolute administrative nightmare. And the political operatives in the administration felt the public health service was just too sluggish.
Sluggish, how? Like they wouldn't get with the program.
Pretty much. The PHS was dominated by career medical professionals. The politicians viewed them as traditionalists, perhaps too focused on pure medicine and epidemiology, and totally resistant to the rapid, politically expedient timelines that the White House was demanding.
Oh, I see. So there was also a massive civil rights component to this friction,
Yes,
right?
a massive one.
Because Title VI of the Civil Rights Act tied federal funding, which included all those newly created Medicare funds, directly to the desegregation of hospitals.
Which is revolutionary.
The federal government suddenly had the leverage to force thousands of segregated hospitals in the South to integrate simply by threatening to withhold their Medicare dollars.
But enforcing that required aggressive, immediate political action.
Right. And the politicos at HEW felt that the old guard doctors at the PHS were just too hesitant. They were too entrenched in their traditional ways of operating with these hospitals to aggressively enforce these new political realities.
The politicians felt the doctors were getting in the way of the politics.
So by shifting the line authority to the Assistant Secretary for Health, the administration effectively bypassed the medical establishment entirely.
Exactly. They put political appointees, who were directly beholden to the administration's goals, firmly in the driver's seat of public health policy.
And the doctor was relegated to the passenger seat.
With a megaphone. And we must impartially highlight a crucial theme from the sources here, because it really upends a massive modern assumption. The gutting of the PHS was a bipartisan, technocratic phenomenon.
Yeah, that really surprised me. Because today, when we hear about government health programs being gutted or scientific agencies being weakened, the narrative frequently points to conservative, anti-regulation ideologies.
Right, that's the common assumption.
But the 1968 evisceration of the Public Health Service was executed by a Democratic administration. It proves that the weakness of the Surgeon General isn't merely the work of politicians trying to shrink the government. It is a structural reality of the modern executive branch.
Presidents of both parties generally despise having a powerful, independent medical authority who possesses the institutional weight to contradict their political agendas.
They desire the prestige of the doctor's coat, but they demand to hold the leash.
That's a great way to put it. Once the Surgeon General lost the power to dictate policy, the actual regulatory machinery of American public health shifted to the agencies that spun off from the old PHS mandate.
Like the alphabet soup agencies?
Exactly. The real tangible power to regulate food and drugs, to mandate outbreak tracking, to fund billions in biomedical research, all that authority coalesced in the FDA, the CDC, and the NIH.
Leaving the Surgeon General with nothing.
Those agencies became the regulatory teeth of modern public health. The Surgeon General was left floating above them as a highly visible but structurally hollow figurehead.
So by 1968, the CEO had basically been stripped of their company. The budget went to a political appointee, the regulatory power went to the alphabet soup agencies, and the Surgeon General was literally left standing at a podium with nothing but a microphone.
But as we're about to see, a microphone in the right hands can start a revolution.
Yeah. To understand the true mechanics of what the dossier calls the bully pulpit, we have to rewind just 4 years prior to that 1968 reorganization.
To a moment that established the exact blueprint for how a structurally weak office can still wield immense cultural power.
We have to examine Luther Terry and his 1964 report on smoking and health.
Right. Luther Terry served from 1961 to 1965.
So he technically still held the old executive powers during this pivotal moment.
He did. Yet his most famous, world-altering action relied entirely on the credibility of the office, not on his executive mandates.
The mid-century American culture he was navigating was just completely saturated with tobacco.
Yeah.
Over 40% of American adults smoked.
40%. It's almost hard to imagine now.
Right. Cigarettes were heavily advertised on television. They were literally handed out in military rations. People smoked freely in hospitals, on airplanes. The tobacco industry was an absolute titan of the American economy.
And they wielded immense political influence in Washington. You did not cross them lightly.
But the scientific evidence linking smoking to lung cancer had been mounting for over a decade. Still, taking on the tobacco lobby required an act of sheer political will.
So Terry convened an advisory committee of 10 eminent scientists to conduct a comprehensive review of all the literature, and they worked in strict secrecy.
Strict secrecy.
Yeah. And the tactical execution of releasing their findings is just a masterclass in managing a political explosive. They deliberately chose to release the report on a Saturday, January 11th, 1964.
And the report definitively and aggressively concluded that cigarette smoking causes lung cancer.
Right.
Wait, right?
Yes. And choosing a Saturday was a highly calculated move.
Why Saturday?
Because the government knew this report would send shockwaves through the financial system. They released it when the stock markets were closed, specifically to limit the immediate panic dumping of tobacco stocks.
They were trying to avoid a wider market crash.
Exactly. And the press conference itself was managed with the kind of draconian security usually reserved for national security briefings.
What did they do?
They took over 200 reporters and locked them inside an auditorium at the State Department.
Literally lock the doors.
Literally locked the doors. They handed them copies of the dense 387-page report, and they were physically barred from leaving the room or using the telephones to file their stories until a specific designated time.
Wow.
They wanted to ensure that absolutely no one could selectively leak portions to manipulate the markets.
That level of orchestration really underscores the gravity of what they were doing. But here is where it gets really interesting. And this is the mechanism that defines the bully pulpit. Luther Terry did not actually ban a single cigarette.
Right.
He didn't use his executive authority to shut down a tobacco plant. He didn't alter the tax code. The 1964 report was merely an advisory committee's conclusion printed on paper.
That's all it was.
Yet, it completely shifted the tectonic plates of American culture. He wielded the unassailable credibility of his office to tell a devastating scientific truth, and he spoke it clearly to the American people.
And the chronological ripple effects of that single act of communication demonstrate how moral authority precedes bureaucratic change.
Okay, let's trace those ripple effects.
So the report comes out in '64. Just 1 year later, Congress passes the Federal Cigarette Labeling and Advertising Act of 1965, which requires the first ever warning labels on cigarette packs.
Just a year later.
Yeah. Then, in 1971, the Public Health Cigarette Smoking Act goes into effect. That institutes an absolute total ban on cigarette advertising on television and radio.
Which is huge. Stripping tobacco out of the broadcast media ecosystem was an unimaginable political defeat for the industry just a decade prior.
Completely unimaginable. And it kicks off a half-century decline in smoking.
So for you listening, the lesson here is that Luther Terry proved the highest leverage of the Surgeon General's office wasn't actually bureaucratic command.
No, not at all.
I mean, if he had somehow tried to ban smoking by executive fiat in 1964, the tobacco industry would have destroyed him in federal court within a week.
Oh, they would have eaten him alive.
Yeah.
And Congress would have just stripped his funding.
Right. His true power was the ability to stand up, bypass the political filters, and fundamentally alter what the American public believed to be true.
He showed that a microphone, when used with absolute scientific integrity, can generate the public pressure necessary to force the legislative and regulatory branches to finally act.
But, Terry pulled that alarm with the implicit backing of his superiors, right? He was technically allowed to do it.
True. He had the green light.
The true test of the modern post-1968 office is what happens when a Surgeon General tries to pull the alarm while their own political bosses are desperately trying to cut the wire.
Oh, boy. Yes.
So, if Terry showed the potential of the pulpit, C. Everett Koop in the 1980s proved that one person's sheer nerve could overcome a complete lack of institutional power.
And actively outmaneuver a hostile administration.
Exactly. Koop is arguably the most consequential modern holder of the office, and his tenure is built entirely on paradox.
Let's talk about Koop.
So President Ronald Reagan nominated him in March of 1981. At the time, Koop was a highly distinguished pediatric surgeon. He was famous for separating conjoined twins.
He was brilliant.
But he was also a fiercely outspoken, religiously conservative opponent of abortion.
Which made him incredibly controversial.
The political left viewed his nomination as a horrifying signal. They thought the Reagan administration intended to turn the nation's highest medical office into a platform for fundamentalist ideology.
And his confirmation fight was a punishing 9-month ordeal. Public health advocates fought him tooth and nail. The media frequently and viciously mocked his appearance. You know, he had that distinctive beard.
Right.
They mocked his beliefs, and they started calling him Dr. Kook.
Dr. Kook. Wow.
They genuinely believed he was a fringe ideologue who would just substitute dogma for science.
But once he finally survived that confirmation gauntlet and put on the uniform, he completely stunned both his fiercest critics and his most ardent supporters.
Because his tenure collided directly with the explosion of the AIDS crisis.
Right. And the Reagan administration's early handling of the AIDS epidemic was defined by this terrifying, deliberate silence. The virus was ravaging marginalized communities, specifically gay men and intravenous drug users.
And many within the conservative political base viewed the disease through a highly moralistic, punitive lens.
They saw it as a moral failing rather than a viral pathogen.
Exactly. So there was this intense, overwhelming pressure from the White House for Koop to either remain entirely silent on the issue or to issue moralizing verdicts that aligned with their conservative social policy.
But Koop didn't do that.
No, he didn't. He surveyed the data, observed the soaring mortality rates, and made a conscious decision that the uniform demanded he act as a physician first.
He utterly refused to treat AIDS as a moral failing. He framed it strictly as a public health emergency.
And in 1986, he leveraged his position to issue the Surgeon General's report on AIDS. Knowing the bureaucracy would attempt to water down or suppress the findings, he took this extraordinary step.
What did he do?
He largely drafted the report himself, in his own basement.
In his basement.
Yes. He did it to severely limit the administration's ability to interfere with the drafting process.
That is amazing. And the contents of that 1986 report were absolutely explosive for a Reagan appointee. Koop explicitly, unequivocally urged the widespread use of condoms to prevent transmission. He called for early, frank, and comprehensive sex education in public schools, starting as early as late elementary school.
He didn't just advocate for abstinence. He demanded explicit instruction on how individuals could actually protect themselves.
He completely circumvented the moral panic gripping the nation's capital and focused purely on the mechanics of disease prevention.
Now, writing a report is an exercise in utilizing the microphone. But what he engineered in 1988 crosses over into bureaucratic legend.
This is my favorite part of the dossier.
It illustrates precisely how a leader with no budget and no line authority can force action. In 1988, Koop recognized that vast swaths of the American public still harbored dangerous, unscientific beliefs about how HIV was transmitted.
Right. People were terrified to even touch someone with HIV.
Exactly. He wanted to ensure every single household in the country had accurate information. Because he drafted an 8-page brochure titled Understanding AIDS. It was written in blunt, accessible language that directly addressed sex and drug use.
And the administration officials were horrified. They were violently opposed to the federal government mass distributing an explicit pamphlet about sexual behavior and needles.
They threw up every conceivable bureaucratic roadblock.
So how does a surgeon general with no operational agency and no budgetary control manage to mail a pamphlet to 107 million households?
It was the largest public health mailing in United States history.
Right. How did he bypass the White House to do that?
Well, he engaged in a masterclass of interagency maneuvering, and he spent his personal credibility. While his office lacked a budget for such an endeavor, the CDC, which held the actual regulatory and financial power, had funds allocated for AIDS education.
Tricky.
So Koop coordinated directly with the CDC to bankroll the printing and the postage. He utilized their administrative machinery while stamping his own face and his title on the cover to lend it unassailable authority.
And he coordinated the logistics directly with the United States Postal Service.
He basically dared the White House to stop him. By 1988, Koop had established a reputation as this unshakable, profoundly honest broker. He used the prestige of his uniform and his direct connection with the American public to build a fortress around himself.
He made it politically toxic for the administration to silence him.
Exactly. The sheer political cost of the Reagan White House publicly canceling an enormous, life-saving mailing that was coordinated by their own conservative Surgeon General during a terrifying epidemic, it was simply too high.
He weaponized his own unfireability.
He really did. And he deployed that same relentless combative energy against the tobacco industry, too.
Right. In 1984, long before it was culturally acceptable, Koop called for a smoke-free society by the year 2000.
He heavily spotlighted the massive dangers of secondhand smoke, which fundamentally altered the whole political debate. It shifted the narrative from an individual's right to harm themselves to a public health imperative to protect innocent bystanders.
And then, in his monumental 1988 report, he explicitly likened the addictive properties of nicotine to those of heroin and cocaine.
Making that comparison in 1988 was revolutionary. It completely reframed how the public, and eventually lawmakers, viewed the actions of the tobacco industry.
The paradox of Koop's legacy is really profound, because by the time his tenure concluded, the political dynamics had inverted entirely.
It was a total 180.
The conservative allies who had fiercely championed his nomination felt profoundly betrayed by his stance on condoms and sex education. But conversely, the liberal public health advocates who had labeled him Dr. Kook were openly praising him as a national hero.
Koop possessed absolutely no more institutional power than any other post-1968 Surgeon General. His office was structurally hollow.
Right.
Yet he utilized his personal moral authority, his willingness to endure immense political unpopularity, and his fierce, uncompromising commitment to medical truth to shift public understanding more than any piece of legislation could have.
He proved the pulpit can work.
But it requires a leader who is entirely fearless.
Fearlessness is a potent weapon, but, it carries an inherent terrible vulnerability. Koop survived because he managed to forge his political armor before his most controversial battles.
Right, he built up that credibility first.
But what happens when a surgeon general attempts to use that exact same candid microphone, only to discover they have absolutely no institutional armor to protect them when the political winds violently shift?
This brings us to 1993 and the tragic fragility of the pulpit, embodied by Joycelyn Elders.
Joycelyn Elders. She represents the absolute zenith of this institutional vulnerability. She was sworn in during September of 1993 under the administration of Bill Clinton.
And she was a monumental trailblazer, the first African-American and the second woman to ever hold the role.
And much like Koop, she was fiercely, unapologetically outspoken. She operated with a deep conviction that her duty was to the health of marginalized populations.
She did not mince words, and she absolutely refused to temper her medical advice for political palatability.
She advocated heavily for the distribution of condoms in public schools to combat skyrocketing rates of teen pregnancy and HIV transmission. She pushed relentlessly for comprehensive sex education.
She even publicly suggested that the government should, at the very least, study the potential public health effects of legalizing drugs as a mechanism to reduce violent crime.
She was unafraid of controversy because she believed the uniform demanded absolute candor.
But her outspokenness inevitably collided with the brutal political realities of an office that is entirely reliant on the goodwill of the president.
The fatal moment arrived on December 1st, 1994, during a World AIDS Day event at the United Nations. Elders delivered a speech, and afterward, during a routine question-and-answer session, a psychologist in the audience posed a question.
A question about the role of masturbation in preventing young people from engaging in riskier, potentially fatal sexual behaviors.
And she answered the question honestly from a purely medical and public health perspective.
She replied by stating, quote, "I think that is part of human sexuality, and perhaps it should be taught."
Perhaps it should be taught. That single sentence, delivered in a medical context at an AIDS conference, that one sentence sealed her fate.
The backlash was instantaneous, coordinated, and overwhelming. Conservative commentators and politicians weaponized the remark immediately. They framed it not as a public health discussion, but as irrefutable evidence that Elders was a radical attempting to corrupt American children.
And the political pressure on the Clinton White House escalated from a simmer to a boil within hours.
Within a matter of days, she was gone. President Clinton swiftly asked for her resignation.
The institutional irony of her firing is just staggering, and it reveals the true architecture of Washington power. Elders was fired by President Clinton, a Democrat, the leader of her own party, and the very man who had nominated her just a year prior.
What's fascinating here is that this illustrates perfectly that partisanship cuts both ways regarding the vulnerability of the Surgeon General. Think about it. A Democratic administration stripped the office of its executive power in 1968. A Republican appointee wielded its voice most effectively in the 1980s by defying his own party. And here, A Democratic president ruthlessly silenced his own appointee.
The fragility of the Surgeon General is an institutional feature. When you possess no budget, you control no regulatory agency, and you hold no independent statutory authority, your survival depends entirely upon the political convenience of the president.
It is the dark mirror of the bully pulpit. Koop survived because his carefully cultivated authority made it politically toxic to silence him. Elders was destroyed because the political cost of defending her candor became higher than the cost of firing her.
It proves that the very same office whose only real asset is unfiltered speech will immediately annihilate its holder for speaking candidly the moment that speech becomes a liability.
A pulpit without structural power is entirely revocable.
So looking at the decades since Joycelyn Elders was forced out, what has become of this weakened, fragile office?
Well, the trend is one of increasing marginalization. From the 2000s up through the 2020s, we see recurring, remarkably long vacancies. Administrations frequently allow the post to sit empty for months or even years, relying on acting officials.
The position is increasingly viewed by the executive branch as more of a political headache than a bureaucratic necessity.
And the contrast with other agencies is stark. I mean, if the FDA commissioner slot sits empty, the pipeline for approving new life-saving drugs grinds to a halt. The pharmaceutical industry panics.
Right.
If the CDC director position is vacant, the national tracking of viral outbreaks stalls and state health departments lose their coordination. But if the Surgeon General slot is empty,
Nothing happens.
nothing administratively breaks. The bureaucratic machinery of public health just hums along without them.
We continually see proposals to shrink the remaining vestiges of the old public health service, too. The source dossier notes Ronald Reagan's 1981 closure of the remaining PHS hospitals. That severed the last major physical infrastructure tied to the old era.
And even recently, in 2018, there were serious executive branch proposals to significantly cut the size and funding of the Commission Corps itself.
So the overarching thesis of the historical record here is that the Public Health Service has become a perennially low-power entity within the federal government.
A stepchild, really.
Yeah, the stepchild. Its influence was always borrowed. It was borrowing the credibility of a respected physician. It was entirely moral, and it remains deeply fragile.
So what does this all mean? If the office literally has no real power, if it can be silenced by a single controversial sentence, if administrations routinely leave it vacant because it holds no operational utility, why do we still care?
Yeah, when a new virus emerges or a localized outbreak causes panic and the Surgeon General steps up to the podium in that uniform, why does the nation still quiet down and listen?
I think it speaks to a profound psychological need within the American public. We navigate an incredibly fragmented, confusing, and often terrifying world regarding our health.
We really do. We are bombarded with dense statistical data from the CDC, complex regulatory updates from the FDA, conflicting nutritional studies in the media,
And endless, dangerous noise on social media platforms. In the midst of all that chaos, citizens desperately crave a singular, unified voice of reason.
They want a doctor to look them in the eye and say, here's the truth of what is happening, and here's exactly what you need to do to protect your family.
The Surgeon General fulfills that role, symbolically. They serve as the human, compassionate face of an otherwise cold, impenetrable federal bureaucracy. Even if the actual regulatory power lies hidden deep within the FDA or the CDC, the public psychologically requires the symbol of the nation's doctor.
So we have traced a remarkable evolution today. We examined how the 1968 reorganization turned a commanding chief executive with line authority into a mere voice.
We saw how Luther Terry in 1964 and C. Everett Koop in the 1980s proved that a brave, incredibly stubborn individual could use that voice to change the beliefs of a nation and save countless millions of lives.
Actively maneuvering around political resistance to do it, and we saw the tragic reality of Joycelyn Elders in 1994, proving how quickly that voice can be snuffed out when it lacks any structural protection.
The immediate application for you, listening right now and navigating modern health news, is to understand this dynamic. The next time you see a public health official speaking, ask yourself, are they wielding institutional command or are they spending their personal moral capital?
Right. Are they announcing a mandate that they actually have the regulatory teeth to enforce, or are they relying entirely on the prestige of their office to persuade you?
Understanding the difference between regulatory power and the bully pulpit will profoundly change how you consume and interpret health directives.
I want to leave you with a final lingering thought to mull over, returning to that image of the gold-braided uniform we started with. We have seen that the absolute greatest public health victories of the last century, getting Americans to recognize the lethality of smoking and forcing the government to face the reality of the AIDS crisis, they were achieved by leaders who possessed almost zero formal power.
They had only moral authority, scientific integrity, and a microphone.
Exactly. So, does formal bureaucratic power actually dilute a truth teller's impact? Perhaps true influence, the kind of influence that permanently alters culture and saves lives, doesn't require a massive budget or a vast agency at all. Maybe all it requires is the sheer, unyielding courage to step up to the podium, put on the uniform, and speak the truth when absolutely no one else will.